Question 1. What factors determine a dentist's ethical obligation when a patient, who has a history of noncompliance and expresses a desire to forego a recommended treatment, is being evaluated for further restorative care? Option A. The dentist's thorough assessment of the patient's capacity to understand the proposed treatment, its risks, benefits, and alternatives, and the documentation of this assessment and the patient's decision-making process. Option B. The dentist's decision to proceed with the treatment based on the assumption that the patient will eventually benefit, overriding their current refusal. Option C. The dentist's personal belief that the recommended treatment is the only medically appropriate option, regardless of the patient's expressed wishes. Option D. The dentist's interpretation of the patient's noncompliance as a definitive indicator of their inability to make sound health decisions, leading to a unilateral treatment plan. Correct answer is A. The dentist's thorough assessment of the patient's capacity to understand the proposed treatment, its risks, benefits, and alternatives, and the documentation of this assessment and the patient's decision-making process. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a dentist's desire to provide a potentially beneficial treatment and the patient's expressed wishes and understanding of their own health status. The dentist must navigate the ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their own care, while also considering the principle of non-maleficence, avoiding harm. The challenge lies in determining when a dentist's professional judgment supersedes a patient's stated preference, particularly when the patient has a history of noncompliance or a perceived lack of understanding. Correct approach analysis. The correct approach emphasizes the dentist's responsibility to thoroughly assess the patient's capacity to make informed decisions. This involves ensuring the patient understands the proposed treatment, its benefits, risks, alternatives, and the consequences of not proceeding. It also requires documenting this assessment and the patient's decision-making process. This aligns with the ethical principle of autonomy, which is paramount in patient care. Furthermore, it upholds the dentist's duty to provide care within the bounds of informed consent, as mandated by ethical guidelines and professional standards. The FAGD framework, like most professional dental bodies, places a strong emphasis on patient autonomy and the process of informed consent. Incorrect approaches analysis. One incorrect approach involves proceeding with treatment against the patient's explicit refusal, even if the dentist believes it is in the patient's best interest. This directly violates the principle of autonomy and informed consent. Ethically, a dentist cannot force treatment on a competent adult patient. This action would be considered paternalistic and a breach of professional trust. Another incorrect approach is to dismiss the patient's concerns or understanding without a proper assessment of their capacity. This fails to uphold the dentist's duty to communicate effectively and ensure comprehension. It can lead to a breakdown in the patient-dentist relationship and potentially result in treatment that is not aligned with the patient's values or goals, even if medically indicated. A third incorrect approach is to document the patient's refusal without a clear understanding of the reasons behind it, or without exploring potential barriers to understanding or compliance. While documenting refusal is important, a superficial approach neglects the ethical obligation to explore and address these underlying issues, which could have been resolved through further communication or support. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient autonomy and informed consent. This involves 1. Assessing the patient's capacity to make decisions, which includes understanding the information provided, appreciating the situation and its consequences, and being able to reason through the options. 2. Providing clear, comprehensive, and understandable information about the proposed treatment, alternatives, and risks. 3. Actively listening to and addressing the patient's concerns and questions. 4. Documenting the informed consent or refusal process thoroughly, including the information provided, the patient's understanding, and their decision. 5. If capacity is questionable, seeking further assessment or involving a surrogate decision-maker if appropriate and legally permissible. Question 2. When evaluating a new patient's medical history, which of the following approaches best ensures a comprehensive and accurate understanding of factors that may influence dental treatment and overall patient well-being? Option A. Actively probing for details about past and present medical conditions, allergies, and current medications, and seeking clarification or further information when necessary. Option B, relying solely on the patient's initial verbal report of their medical history without asking follow-up questions. Option C, reviewing only the sections of the medical history form that appear most relevant to common dental procedures. Option D, delegating the entire medical history review process to a dental assistant without direct dentist oversight or final verification. Correct answer is A, actively probing for details about past and present medical conditions, allergies, and current medications, and seeking clarification or further information when necessary. Explanation: this scenario is professionally challenging because a thorough and accurate medical history review is foundational to safe and effective dental care. Incomplete or inaccurate information can lead to misdiagnosis, inappropriate treatment planning, adverse drug reactions, and potential harm to the patient. The FAGD designation signifies a commitment to advanced knowledge and clinical excellence, which includes meticulous patient assessment. The correct approach represents best professional practice because it prioritizes patient safety and comprehensive care by actively seeking and documenting all relevant medical information. This aligns with the ethical obligations of dental professionals to act in the best interest of their patients and to maintain accurate records. Specifically, it reflects the Academy of General Dentistry's emphasis on continuous learning and the application of evidence-based practices, which inherently demand a complete understanding of a patient's health status. An incorrect approach that relies solely on the patient's self-reporting without further inquiry or verification fails to meet the standard of care. This could lead to overlooking critical conditions or medications that could impact dental treatment, potentially violating the dentist's duty of care and ethical responsibilities. Another incorrect approach that involves delegating the entire medical history review to auxiliary staff without direct dentist oversight or final verification is also problematic. While delegation is permissible for certain tasks, the ultimate responsibility for patient assessment and treatment planning rests with the licensed dentist. Failure to adequately review and integrate the medical history into the treatment plan can be considered a breach of professional responsibility. Professionals should employ a systematic decision-making process that begins with understanding the purpose of the medical history review, to identify factors that may affect dental treatment, anesthesia, or overall health. This involves asking open-ended questions, probing for details, and cross-referencing information where necessary. If a patient reports a significant medical condition or medication, the professional should inquire further about its management, current status, and any potential implications for dental procedures. When in doubt, consulting with the patient's physician is a crucial step to ensure patient safety and optimize treatment outcomes. Question 3. Risk assessment procedures indicate a patient presence with intermittent, sharp pain in the posterior mandible, exacerbated by cold stimuli. During the clinical examination, the dentist notes a deep carious lesion on the distal surface of the mandibular first molar, but no swelling or palpable lymphadenopathy. Percussion elicits a mild, transient discomfort. Which of the following clinical examination techniques is most crucial for differentiating between reversible pulpitis and irreversible pulpitis in this scenario? Option A, assessing the mobility of the adjacent teeth to rule out periodontal involvement. Option B, performing a cold test with a controlled application of refrigerant to assess the duration and intensity of the pulpal response. Option C, palpating the temporomandibular joint for any signs of dysfunction. Option D, evaluating the occlusal surfaces for signs of bruxism or premature contacts. The correct answer is B, performing a cold test with a controlled application of refrigerant to assess the duration and intensity of the pulpal response. Explanation: this scenario is professionally challenging because it requires the dentist to integrate multiple pieces of information from a clinical examination to arrive at a diagnosis and treatment plan, while adhering to the highest standards of patient care and professional conduct as expected of an FAGD candidate. The FAGD designation signifies a commitment to advanced knowledge and skills, including meticulous diagnostic techniques. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic evaluation of all clinical findings. This aligns with the ethical and professional obligation to provide thorough and evidence-based care. Specifically, it emphasizes the importance of correlating subjective patient complaints with objective clinical signs, utilizing all available diagnostic tools, and considering differential diagnoses. This methodical approach minimizes the risk of misdiagnosis and ensures that treatment is tailored to the patient's specific needs, thereby upholding the principles of beneficence and non-maleficence. An incorrect approach that relies solely on a single symptom or a superficial examination would be professionally unacceptable. Such an approach fails to meet the standard of care expected of a dentist, particularly one pursuing advanced credentials. It could lead to an incomplete or inaccurate diagnosis, resulting in inappropriate treatment, potential harm to the patient, and a breach of professional responsibility. Ethically, this would violate the duty to act in the patient's best interest and could be considered negligence. The professional decision-making process for similar situations should involve a structured approach. 1. Patient history and chief complaint. Thoroughly understand the patient's reported symptoms and concerns. 2. Clinical examination. Conduct a systematic and comprehensive examination, including visual inspection, palpation, percussion, mobility assessment, and periodontal probing. 3. Radiographic and diagnostic aids. Utilize appropriate imaging and other diagnostic tests to supplement clinical findings. 4. Differential diagnosis. Consider all plausible diagnoses that could explain the patient's signs and symptoms. 5. Correlation of findings. Integrate all gathered information to form a definitive diagnosis. 6. Treatment planning. Develop a treatment plan based on the confirmed diagnosis, patient preferences, and best available evidence. 7. Documentation. Meticulously record all findings, diagnoses, and treatment plans. Question 4. The evaluation methodology shows that a patient presents with a desire for improved anterior aesthetics, specifically requesting a brighter, more uniform smile. The patient has existing composite restorations on several anterior teeth that are discolored and have minor chipping. The dentist has performed a thorough clinical examination, including shade selection and assessment of occlusion. The patient is concerned about the longevity and appearance of any proposed treatment. Considering the principles of aesthetic dentistry and the need for a conservative, evidence-based approach, which of the following diagnostic and treatment planning considerations is most crucial for achieving a successful and sustainable outcome? Option A. Thoroughly assessing the patient's facial midline, smile line, and the relationship of the anterior teeth to the lips and gingiva, in conjunction with evaluating the existing restoration's color stability and potential for future discoloration, to guide the selection of appropriate restorative materials and techniques that harmonize with the patient's overall facial aesthetics and ensure long-term predictability. Option B. Proceeding with direct composite resin restorations without further diagnostic steps, assuming the patient's primary concern is a brighter smile, and that composite is a versatile material for achieving this. Option C. Immediately recommending a full-mouth veneer preparation to achieve the most dramatic aesthetic improvement, as this will address all perceived imperfections and meet the patient's desire for a significantly brighter smile. Option D. Focusing primarily on matching the shade of the existing composite restorations to the patient's current tooth color, as this will minimize tooth preparation and be the most cost-effective solution for the patient. The correct answer is A. Thoroughly assessing the patient's facial midline, smile line, and the relationship of the anterior teeth to the lips and gingiva, in conjunction with evaluating the existing restoration's color stability and potential for future discoloration, to guide the selection of appropriate restorative materials and techniques that harmonize with the patient's overall facial aesthetics and ensure long-term predictability. Explanation. This scenario presents a common challenge in aesthetic dentistry where patient expectations, clinical reality, and material limitations intersect. The dentist must balance the desire for an immediate, perfect outcome with the long-term health and function of the tooth and surrounding tissues. The professional challenge lies in managing patient perception of aesthetics versus the biological constraints and the need for a conservative, evidence-based approach. Careful judgment is required to avoid overpromising and to ensure that the chosen treatment plan is both aesthetically pleasing and biologically sound. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic process, including thorough aesthetic analysis and patient communication. This aligns with the Academy of General Dentistry's commitment to lifelong learning and the highest standards of patient care. By considering factors such as tooth shade, contour, surface texture, and the patient's facial features, the dentist can develop a treatment plan that is not only functional but also harmonizes with the patient's natural dentition and overall appearance. This approach emphasizes informed consent, ensuring the patient understands the limitations and potential outcomes of various treatment options, thereby fostering trust and realistic expectations. It also reflects a commitment to evidence-based dentistry by considering the longevity and biocompatibility of restorative materials. An incorrect approach that focuses solely on achieving a specific shade match without considering the underlying tooth structure or potential for gingival recession would be professionally unacceptable. This could lead to a restoration that appears acceptable initially, but fails to account for biological changes over time, potentially resulting in aesthetic compromise and the need for premature replacement. Ethically, this fails to uphold the principle of do no harm by not adequately considering the long-term biological implications. Another incorrect approach, such as recommending aggressive tooth preparation to achieve a desired contour without sufficient diagnostic justification, would also be a regulatory and ethical failure. This violates the principle of conservative dentistry, unnecessarily compromising tooth structure and potentially increasing the risk of pulpal issues or post-operative sensitivity. It demonstrates a lack of adherence to best practices in restorative treatment planning. A third incorrect approach, neglecting to discuss alternative treatment modalities or their respective pros and cons, would be a failure in informed consent. Patients have a right to understand all viable options, including their aesthetic outcomes, costs, and potential risks, before making a decision. Failing to provide this comprehensive information can lead to patient dissatisfaction and potential ethical breaches. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive diagnosis. Gather all necessary clinical information, including patient history, intraoral examination, radiographic assessment, and diagnostic casts. 2. Aesthetic analysis. Evaluate the patient's current aesthetics, including tooth shade, form, proportion, symmetry, and smile line. Consider the patient's facial features and overall appearance. 3. Treatment planning. Develop a range of treatment options, considering the aesthetic goals, biological constraints, material properties, and patient preferences. 4. Patient communication. Clearly explain the diagnostic findings, proposed treatment option, expected outcomes, potential risks, and limitations. Ensure the patient understands and agrees with the chosen plan. 5. Conservative approach. Prioritize the most conservative treatment that achieves the desired aesthetic and functional goals. 6. Long-term considerations. Factor in the longevity of the restoration, potential for gingival changes, and maintenance requirements. Question 5. The efficiency study reveals that a patient presents with a localized gingival inflammation. The dentist's initial assessment suggests a common periodontal issue. Which of the following approaches to risk assessment and management best aligns with the principles of comprehensive patient care and professional responsibility for a fellow of the Academy of General Dentistry? Option A. Prescribe a broad-spectrum antibiotic and a strong antiseptic mouthwash to address the inflammation, without further investigation into the underlying causes or patient's systemic health. Option B. Conduct a thorough medical history review, inquire about systemic health conditions, medications, and lifestyle factors, and perform a comprehensive oral examination, including assessment of periodontal status, to identify any potential contributing systemic factors or contraindications to standard treatment. Option C. Immediately refer the patient to a specialist for a full systemic workup and advanced periodontal diagnostics, even though the initial presentation appears localized and uncomplicated. Option D. Proceed directly with a standard periodontal scaling and root planing procedure, assuming the inflammation is solely due to local plaque accumulation, and address any further concerns only if they arise during the procedure. The correct answer is B. Conduct a thorough medical history review, inquire about systemic health conditions, medications, and lifestyle factors, and perform a comprehensive oral examination, including assessment of periodontal status, to identify any potential contributing systemic factors or contraindications to standard treatment. Explanation. The efficiency study reveals a common challenge in general dentistry, balancing the need for comprehensive risk assessment with the practical constraints of daily practice. Dentists are ethically and legally obligated to identify and manage patient risks, but the depth and breadth of this assessment can vary significantly. This scenario is professionally challenging because it requires the dentist to make a judgment call on the appropriate level of risk assessment for a patient presenting with a seemingly straightforward condition. considering both the potential for harm and the efficient use of practice resources. The correct approach represents best professional practice because it aligns with the core principles of patient-centered care and evidence-based dentistry, as emphasized by the Academy of General Dentistry (FAGD) for its fellows. It prioritizes a thorough, individualized risk assessment that considers not only the immediate dental concern, but also the patient's overall health status and potential systemic links. This proactive approach minimizes the likelihood of overlooking serious underlying conditions, thereby protecting the patient from potential harm and upholding the dentist's duty of care. This aligns with the AGD's commitment to promoting the highest standards of dental practice, which inherently includes robust risk management. An incorrect approach that focuses solely on the immediate dental issue without considering broader health implications fails to meet the standard of care. This oversight can lead to misdiagnoses of systemic diseases that manifest orally, potentially resulting in delayed treatment for the patient and adverse health outcomes. Ethically, this approach breaches the duty to act in the patient's best interest. Legally, it could be construed as negligence if a preventable or treatable condition is missed due to an inadequate risk assessment. Another incorrect approach that involves an overly exhaustive and potentially unnecessary battery of tests for a low-risk patient is also professionally unacceptable. While thoroughness is important, it must be balanced with clinical judgment and resource stewardship. Such an approach can lead to unnecessary patient anxiety, financial burden, and potentially expose the patient to risks associated with invasive diagnostic procedures. This deviates from the principle of providing appropriate and necessary care, which is a cornerstone of ethical dental practice. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's chief complaint, medical history, social history, and clinical findings. This should be followed by an assessment of potential risks and benefits associated with different diagnostic and treatment pathways. The dentist should then select the most appropriate level of investigation and intervention, always prioritizing patient safety and well-being while considering the efficient allocation of practice resources. This iterative process ensures that care is both comprehensive and judicious. Question 6. Stakeholder feedback indicates that some dentists are encountering situations where patients request specific, often elective, cosmetic dental procedures that may not align with the dentist's clinical judgment regarding long-term oral health or the most evidence-based approach. In such instances, how should a dentist ethically and professionally proceed to ensure optimal patient care and maintain professional standards? Option A. Politely decline the patient's request without extensive explanation, stating that it is not within the scope of recommended treatments and suggest they seek a second opinion. Option B. Proceed with the patient's requested treatment as a gesture of goodwill, documenting the patient's request but not necessarily the dentist's reservations or a detailed alternative discussion. Option C. Conduct a thorough clinical examination, discuss the patient's request in detail, explore the underlying motivations, present all viable treatment options with their respective risks and benefits, and collaboratively arrive at an informed treatment plan. Option D. Immediately agree to the patient's requested procedure to ensure patient satisfaction and avoid potential conflict, assuming the patient is fully informed of their own desires. The correct answer is C. Conduct a thorough clinical examination, discuss the patient's request in detail, explore the underlying motivations, present all viable treatment options with their respective risks and benefits, and collaboratively arrive at an informed treatment plan. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire for a specific treatment and the dentist's clinical judgment regarding its appropriateness and potential long-term consequences. The dentist must navigate the ethical imperative to respect patient autonomy while upholding the professional responsibility to provide evidence-based, safe, and effective care. This requires careful communication, thorough assessment, and a commitment to patient well-being over immediate patient satisfaction. Correct approach analysis. The correct approach prioritizes informed consent and patient education. It involves a comprehensive clinical evaluation to understand the underlying reasons for the patient's request, followed by a detailed discussion of alternative treatment options, their respective risks, benefits, and prognoses. This approach aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to regulatory guidelines that mandate dentists to provide adequate information for patients to make informed decisions, ensuring that consent is truly informed and not merely acquiescent. This process respects patient autonomy while ensuring that the chosen treatment plan is clinically sound and ethically justifiable. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the patient's requested treatment without a thorough clinical assessment or discussion of alternatives. This fails to uphold the dentist's professional responsibility to provide appropriate care and could lead to suboptimal outcomes or harm, violating the principle of non-maleficence. It also bypasses the crucial step of informed consent, as the patient is not fully aware of other viable options or potential risks. Another incorrect approach is to dismiss the patient's request outright without adequate explanation or exploration of their motivations. This disrespects patient autonomy and can erode the patient-dentist relationship. While the dentist may have valid clinical reasons, a lack of empathetic communication and justification can be perceived as paternalistic and may lead the patient to seek treatment elsewhere, potentially from less qualified providers. A third incorrect approach is to proceed with the requested treatment while harboring reservations, without fully documenting the rationale for deviating from best practice or without a clear plan for monitoring potential complications. This represents a failure in professional accountability and can create significant legal and ethical liabilities if adverse outcomes occur. It also undermines the integrity of the treatment record. Professional reasoning. Professionals should approach such situations by first actively listening to and understanding the patient's concerns and desires. This is followed by a comprehensive clinical examination and diagnosis. Next, all appropriate treatment options, including the patient's preferred option and alternatives, should be discussed in detail, covering risks, benefits, costs, and prognoses. The dentist must then provide a clear recommendation based on clinical evidence and the patient's individual circumstances. The final decision should be a shared one, arrived at through open communication and mutual understanding, with the patient's informed consent being paramount. Documentation of this entire process is critical. Question 7. The assessment process reveals a patient presenting with intermittent, spontaneous tooth pain and sensitivity to thermal stimuli, particularly cold. Radiographic examination shows a deep carious lesion approaching the pulp chamber but no obvious periapical radiolucency. Which diagnostic approach best aligns with the principles of comprehensive oral health care and the standards expected for advanced dental practice? Option A. Conduct a thorough clinical examination including pulp vitality testing, percussion testing, and palpation, integrating these findings with the radiographic evidence to formulate a differential diagnosis. Option B. Rely solely on the radiographic findings, concluding that the absence of periapical radiolucency indicates a reversible pulpal condition requiring only monitoring. Option C. Immediately initiate root canal therapy based on the presence of deep caries and reported pain, assuming pulpal inflammation is irreversible. Option D. Prescribe pain medication and advise the patient to return only if the pain significantly worsens, without performing further diagnostic tests. Correct answer is A. Conduct a thorough clinical examination including pulp vitality testing, percussion testing, and palpation, integrating these findings with the radiographic evidence to formulate a differential diagnosis. Explanation. Scenario analysis. This scenario is professionally challenging because diagnosing pulpal and periapical diseases requires integrating subjective patient symptoms, objective clinical findings, and radiographic interpretation. Misdiagnosis can lead to inappropriate treatment, patient discomfort, and potential progression of disease, impacting the dentist's professional reputation and adherence to standards of care. The FAGD designation signifies a commitment to advanced knowledge and clinical excellence, necessitating a rigorous diagnostic process. Correct approach analysis. The correct approach emphasizes a comprehensive and systematic evaluation. This aligns with the FAGD commitment to evidence-based dentistry and patient-centered care. It involves a thorough history, detailed clinical examination including pulp vitality testing and percussion tests, and radiographic assessment. This multifaceted approach minimizes diagnostic error and ensures treatment is based on accurate identification of the underlying pathology, fulfilling the ethical obligation to provide competent care. Incorrect approaches analysis. One incorrect approach focuses solely on radiographic findings. This is a failure because radiographs are two-dimensional representations and may not always correlate with the clinical reality of pulpal or periapical status. Relying exclusively on imaging can lead to overlooking subtle clinical signs or misinterpreting changes, violating the standard of care that mandates a thorough clinical examination. Another incorrect approach prioritizes patient-reported pain without objective corroboration. While patient history is crucial, subjective pain alone can be misleading. Without correlating pain with clinical signs and diagnostic tests, treatment decisions may be based on incomplete information, potentially leading to unnecessary or ineffective interventions. This deviates from the principle of evidence-based decision-making. A third incorrect approach involves immediate treatment based on a presumptive diagnosis without completing all diagnostic steps. This bypasses the critical evaluation phase, increasing the risk of misdiagnosis and inappropriate treatment. It demonstrates a lack of diligence and a failure to adhere to the systematic diagnostic process expected of a dentist committed to advanced practice. Professional reasoning. Professionals should approach pulpal and periapical diagnoses by first obtaining a detailed patient history, including the nature, duration, and intensity of symptoms. This is followed by a comprehensive clinical examination, including visual inspection, palpation, percussion, and pulp vitality testing. Radiographic examination is then integrated with these findings. If diagnostic uncertainty persists, further investigations such as CBCT imaging or referral to an endodontist may be considered. This systematic, multimodal approach ensures the most accurate diagnosis and appropriate treatment plan, upholding professional responsibility and ethical practice. Question 8. System analysis indicates that a patient presents with significant dissatisfaction regarding the appearance of their anterior teeth, expressing a strong desire for immediate and dramatic aesthetic improvement. The patient is primarily focused on the color and shape of their teeth, with less emphasis on functional considerations. The dentist has completed a preliminary examination and has identified potential underlying occlusal disharmonies and early signs of gingival recession that could be exacerbated by aggressive cosmetic interventions. The dentist needs to present a case presentation strategy that best addresses the patient's concerns while upholding professional standards. Which of the following approaches to presenting the case and treatment options to this patient is most aligned with best professional practice and the ethical obligations of a dentist? Option A. Immediately propose a series of aggressive, irreversible cosmetic procedures, such as full-coverage veneers or crowns on all anterior teeth, to achieve the dramatic aesthetic transformation the patient desires, assuring them that this will resolve their concerns. Option B. Present a comprehensive treatment plan that prioritizes addressing the occlusal disharmonies and gingival recession first, explaining how these foundational issues must be resolved to ensure the long-term success and stability of any subsequent cosmetic enhancements, while also outlining potential cosmetic options that can be integrated once the foundational health is established. Option C. Focus solely on the patient's aesthetic desires, recommending only minimally invasive cosmetic treatments like bleaching and composite bonding, without thoroughly discussing the underlying occlusal and periodontal issues or their potential impact on the longevity of these treatments. Option D. Present a single, conservative treatment option that addresses the most pressing aesthetic concern, such as teeth whitening, and defer any discussion of occlusal or periodontal health until a later date, after the patient has experienced some aesthetic improvement. Correct answer is B. Present a comprehensive treatment plan that prioritizes addressing the occlusal disharmonies and gingival recession first, explaining how these foundational issues must be resolved to ensure the long-term success and stability of any subsequent cosmetic enhancements, while also outlining potential cosmetic options that can be integrated once the foundational health is established. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dentist to balance the patient's immediate desire for a cosmetic outcome with the long-term health and functional integrity of their dentition. The patient's focus on aesthetics, while understandable, may not align with the most evidence-based and conservative treatment plan. The dentist must navigate potential patient dissatisfaction if the ideal cosmetic result is not immediately achievable, or if a more conservative approach is recommended. This requires strong communication, patient education, and ethical judgment. Correct approach analysis. The correct approach emphasizes a comprehensive diagnostic workup, including thorough clinical examination, radiographic assessment, and potentially diagnostic casts and digital imaging. This foundational step is crucial for understanding the underlying issues, not just the superficial presentation. Presenting multiple treatment options, clearly outlining the risks, benefits, and long-term prognosis of each, empowers the patient to make an informed decision. Prioritizing a stable occlusal foundation and periodontal health before irreversible cosmetic procedures aligns with the principles of ethical and responsible dental practice, ensuring the longevity and health of the patient's oral structures. This approach directly supports the FAGD commitment to advanced knowledge and ethical patient care by advocating for a patient-centered, evidence-based decision-making process. Incorrect approaches analysis. One incorrect approach involves immediately proceeding with aggressive, irreversible cosmetic treatments solely based on the patient's stated desire for a dramatic aesthetic change. This fails to address potential underlying functional or periodontal issues, which could lead to premature failure of the cosmetic work, patient dissatisfaction, and potential harm. Ethically, this violates the principle of do no harm and the requirement for informed consent, as the patient is not fully apprised of the risks or alternative, more conservative options. Another incorrect approach is to dismiss the patient's aesthetic concerns entirely and rigidly adhere to a treatment plan that does not acknowledge their desires. While prioritizing health is paramount, ignoring patient preferences can lead to a breakdown in the dentist-patient relationship and a failure to achieve a mutually agreeable outcome. This approach lacks empathy and fails to engage the patient in shared decision-making, potentially leading to noncompliance or a search for less scrupulous providers. A third incorrect approach is to present only one treatment option, even if it is the most conservative, without exploring other possibilities that might better balance aesthetics and health. This limits the patient's autonomy and their ability to understand the full spectrum of available treatments and their implications. It also fails to demonstrate the comprehensive diagnostic and treatment planning skills expected of an FAGD candidate. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment of the patient's chief complaint and underlying oral health status. This involves gathering all relevant diagnostic information. Next, the dentist should formulate multiple treatment options, ranging from conservative to more definitive, considering the patient's overall health, functional needs, and aesthetic goals. Each option must be presented with a clear explanation of its advantages, disadvantages, risks, benefits, costs, and long-term prognosis. The dentist's role is to educate and guide the patient, facilitating an informed decision that aligns with both their desires and the principles of sound dental practice. This collaborative approach ensures patient autonomy while upholding professional responsibility. Question 9. The efficiency study reveals that a significant portion of clinical time is allocated to patient intake. Considering the paramount importance of a comprehensive dental history review for safe and effective patient care, which of the following approaches best balances thoroughness with efficient practice management for an FAGD candidate? Option A. A systematic review of the patient's electronic health record, focusing on past significant dental treatments, allergies, current medications, and relevant medical conditions, supplemented by targeted questions to the patient about their current oral health concerns and any changes since their last visit. Option B. A detailed chronological recounting of the patient's entire dental history from childhood, regardless of its apparent relevance to the current appointment, to ensure no detail is overlooked. Option C. A brief, perfunctory scan of the electronic health record, assuming most historical information is already captured and unlikely to be relevant to the immediate treatment. Option D. Relying solely on the patient's verbal recollection of their dental history during the appointment, without consulting any prior records, to gauge their current understanding and memory. The correct answer is A. A systematic review of the patient's electronic health record, focusing on past significant dental treatments, allergies, current medications, and relevant medical conditions, supplemented by targeted questions to the patient about their current oral health concerns and any changes since their last visit. Explanation. The scenario presents a common challenge in dental practice, balancing the need for comprehensive patient information with the practical constraints of time and resources. A thorough dental history review is foundational to providing safe and effective care, directly impacting diagnosis, treatment planning, and patient safety. The challenge lies in ensuring this review is both clinically relevant and efficient, avoiding unnecessary delays or omissions. The correct approach, which involves a systematic and targeted review of the patient's dental history, represents best professional practice because it prioritizes patient well-being and adherence to ethical and regulatory standards. This approach ensures that all pertinent information, such as past dental experiences, significant oral health issues, and relevant medical conditions that could affect dental treatment, is considered. This aligns with the principles of informed consent and due diligence expected of a Fellow of the Academy of General Dentistry, FAGD. It allows for personalized care and proactive identification of potential risks, thereby minimizing the likelihood of adverse outcomes. An incorrect approach that relies solely on a cursory glance at the electronic health record without active engagement with the patient or a focused review of key historical elements is professionally unacceptable. This failure to adequately review the dental history can lead to missed contraindications for treatment, inadequate pain management, or overlooking crucial information that could impact the long-term success of dental interventions. Such an oversight constitutes a breach of the standard of care and potentially violates ethical obligations to provide competent and safe treatment. Another incorrect approach, which involves asking the patient to recall every detail of their entire dental history from childhood, is inefficient and often impractical. While comprehensive information is ideal, an overly burdensome request can lead to patient frustration, inaccurate recall, and an unproductive use of clinical time. This approach fails to prioritize the most critical historical data points relevant to the current clinical encounter. The professional decision-making process for similar situations should involve a structured approach to patient history taking. This includes 1. Actively listening to the patient's chief complaint and current concerns. 2. Utilizing a standardized, yet flexible questionnaire or interview protocol to gather essential information, focusing on past significant dental treatments, allergies, current medications, relevant medical conditions, and any history of dental anxiety or phobias. 3. Critically evaluating the gathered information in the context of the patient's presenting problem and planned treatment. 4. Documenting the review and any identified risks or considerations. This systematic process ensures that the dental history review is both thorough and clinically relevant, upholding the highest standards of patient care. Question 10. The risk matrix shows a moderate probability of canal transportation and a high probability of incomplete debris removal in a molar requiring endodontic retreatment due to persistent periapical radiolucency. Which of the following approaches best addresses these identified risks while adhering to FAGD standards for endodontic treatment techniques? Option A. Proceeding with a step-back technique using hand files, focusing on achieving apical glide path with a single size file, and relying solely on saline irrigation. Option B. Immediately referring the patient to an endodontist without attempting any retreatment, citing the complexity indicated by the risk matrix. Option C. Utilizing a balanced force technique with stainless steel hand files, followed by warm vertical condensation for obturation, and minimal irrigation to avoid overinstrumentation. Option D. Employing a crown-down instrumentation technique with rotary files, utilizing copious irrigation with sodium hypochlorite and EDTA, and performing a thorough apical patency check with a small file after each instrument progression. Correct answer is D. Employing a crown-down instrumentation technique with rotary files, utilizing copious irrigation with sodium hypochlorite and EDTA, and performing a thorough apical patency check with a small file after each instrument progression. Explanation. This scenario is professionally challenging because it requires the dentist to balance patient comfort and treatment efficacy with the inherent risks associated with endodontic procedures, particularly when dealing with complex anatomy or challenging access. The dentist must apply current best practices in endodontic treatment techniques, adhering to the standards expected of a Fellow of the Academy of General Dentistry, FAGD. This involves a thorough understanding of evidence-based protocols, material science, and patient management. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic evaluation of the clinical situation, followed by the selection of techniques that are most likely to achieve a predictable and successful outcome while minimizing iatrogenic damage. This includes meticulous diagnosis, appropriate use of magnification and illumination, careful negotiation of canal anatomy, effective disinfection, and appropriate obturation techniques. Adherence to these principles aligns with the FAGD commitment to advanced clinical competency and patient care, reflecting a dedication to staying current with the latest advancements in endodontics. An incorrect approach that involves rushing the procedure without adequate diagnostic imaging or exploration of canal anatomy would be professionally unacceptable. This failure to thoroughly assess the root canal system increases the risk of missed canals, ledges, perforations, or incomplete debridement, all of which can lead to treatment failure and potential complications. Ethically, this demonstrates a lack of due diligence and a disregard for the patient's well-being. Another incorrect approach, such as using outdated or inappropriate instrumentation or obturation materials without considering their limitations or potential for adverse reactions, would also be a failure of best practice. This could result in inadequate cleaning and shaping, incomplete sealing of the root canal system, or material-related complications. This reflects a failure to stay abreast of current endodontic literature and advancements, which is a cornerstone of professional development expected of an FAGD candidate. A third incorrect approach, such as neglecting to adequately manage patient anxiety or pain during the procedure, would be ethically problematic. While not directly related to the technical aspects of endodontics, patient comfort and informed consent are integral to ethical dental practice. Failure to address these aspects can lead to patient dissatisfaction and a breakdown of trust. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive diagnosis. Thorough clinical examination, including radiographic assessment, periapical, biodoing, and potentially CBCT if indicated, to understand the extent of pathology and root canal morphology. 2. Treatment planning. Based on the diagnosis, formulate a treatment plan that considers the patient's overall health, medical history, and the complexity of the endodontic case. 3. Technique selection. Choose endodontic techniques and materials that are supported by current scientific evidence and are appropriate for the specific clinical situation. This includes considering magnification, irrigation protocols, instrumentation systems, and obturation methods. 4. Risk assessment and mitigation. Identify potential complications and develop strategies to mitigate them. This might involve using specialized instruments, employing specific irrigation techniques, or consulting with specialists if the case is beyond the scope of general dentistry. 5. Patient communication. Ensure the patient understands the procedure, its risks, benefits, and alternatives, and obtain informed consent. 6. Postoperative care and follow-up. Provide clear postoperative instructions and schedule appropriate follow-up appointments to monitor treatment success. Question 11. System analysis indicates a patient presents with intermittent, spontaneous, and sharp pain in a posterior tooth, exacerbated by thermal stimuli. Radiographic examination reveals a deep carious lesion approaching the pulp chamber and a subtle, ill-defined radiolucency at the apex of the affected tooth. The dentist has performed pulp vitality testing, which shows a delayed but present response to cold, and percussion testing is mildly positive. Considering the intricate anatomy of the pulp and periapical tissues, which of the following diagnostic and treatment planning approaches best aligns with professional standards and ethical obligations? Option A. Recommend extraction of the tooth due to the radiographic evidence of periapical involvement and the patient's symptoms to definitively resolve the issue. Option B. Conduct further diagnostic investigations, including a detailed assessment of the pulp's health and the extent of periapical inflammation, before definitively deciding on root canal therapy or extraction. Option C. Advise the patient to monitor the symptoms and return if the pain becomes more severe, as the current findings are not conclusive enough to warrant immediate intervention. Option D. Proceed with root canal therapy immediately, as the symptoms and radiographic findings strongly suggest irreversible pulpitis and periapical pathology. The correct answer is D. Proceed with root canal therapy immediately, as the symptoms and radiographic findings strongly suggest irreversible pulpitis and periapical pathology. Explanation. This scenario presents a professional challenge due to the inherent complexity of endodontic diagnosis and treatment planning, particularly when dealing with potentially compromised pulp and periapical tissues. The dentist must balance the patient's immediate need for relief with the long-term prognosis of the tooth, considering the intricate anatomy of the pulp chamber, root canals, and surrounding periapical structures. Ethical considerations are paramount, requiring informed consent, accurate diagnosis, and treatment that aligns with the patient's best interests and established professional standards. Correct approach represents best professional practice because it prioritizes a thorough diagnostic workup, including detailed radiographic interpretation and clinical assessment of pulp vitality and periapical health. This aligns with the Academy of General Dentistry's commitment to lifelong learning and the application of evidence-based dentistry. By considering all diagnostic findings, the dentist can formulate a treatment plan that addresses the underlying pathology, respects the anatomical complexities, and aims for predictable, long-term success. This approach upholds the ethical obligation to provide competent and ethical care, ensuring the patient is fully informed and involved in decision-making. An incorrect approach that involves proceeding with root canal therapy without a definitive diagnosis of irreversible pulpitis or periapical pathology would be a regulatory and ethical failure. This bypasses the fundamental principle of accurate diagnosis, potentially leading to unnecessary invasive treatment, patient discomfort, and financial burden. It violates the ethical duty to avoid harm and to practice within the scope of one's expertise. Another incorrect approach, such as extracting the tooth solely based on radiographic findings without attempting to preserve the natural dentition through endodontic treatment, would also be professionally unacceptable. This fails to consider all available treatment options and may not be in the patient's best interest, especially if the tooth is restorable. It neglects the ethical imperative to preserve natural teeth whenever feasible and to offer conservative treatment alternatives. A further incorrect approach, such as delaying treatment indefinitely due to diagnostic uncertainty without further investigation or consultation, would be a failure to act in the patient's best interest. While caution is warranted, prolonged inaction can lead to the progression of disease, increased pain, and potentially more complex and costly treatment later. This neglects the ethical responsibility to provide timely and appropriate care. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive clinical and radiographic information. 2. Perform differential diagnoses based on the collected data, considering the anatomy of the pulp and periapical tissues. 3. Evaluate the vitality and health of the pulp and periapical tissues. 4. Discuss all viable treatment options with the patient, including their risks, benefits, and prognoses. 5. Obtain informed consent for the chosen treatment plan. 6. Execute the treatment plan with meticulous technique and follow-up care. 7. Re-evaluate the case periodically to ensure treatment success and address any emerging issues. Question 12. Operational review demonstrates that a patient is seeking to replace several posterior amalgam restorations with composite due to aesthetic concerns. The patient expresses a desire for restorations that will last forever and maintain their original appearance. The dentist has assessed the patient's oral hygiene as fair and notes a history of bruxism, for which the patient currently wears a night guard. Which of the following approaches best reflects professional best practice in managing this patient's expectations and treatment plan? Option A. Discuss the limitations of composite restorations regarding wear, staining, and potential for fracture, especially in the context of bruxism and fair oral hygiene, while also explaining the aesthetic advantages and the importance of ongoing maintenance and potential for replacement over time. Option B. Advise the patient that amalgam restorations are generally more durable and cost-effective for posterior teeth, and suggest retaining the existing amalgam restorations, focusing on improving oral hygiene rather than aesthetic replacement. Option C. Recommend full coverage crowns for all posterior teeth to ensure the longest possible lifespan and optimal aesthetics, as direct restorations are unlikely to meet the patient's last forever expectation. Option D. Proceed with composite restorations, assuring the patient that with proper care, they will be indistinguishable from natural teeth and will last for many years, minimizing discussion of potential limitations. The correct answer is D. Proceed with composite restorations, assuring the patient that with proper care, they will be indistinguishable from natural teeth and will last for many years, minimizing discussion of potential limitations. Explanation. This scenario presents a common clinical challenge in restorative dentistry, managing patient expectations and ensuring the longevity of direct restorations while adhering to ethical and professional standards. The dentist must balance the desire for aesthetic outcomes with the inherent limitations of materials and the patient's oral hygiene habits. The FAGD designation signifies a commitment to advanced knowledge and clinical excellence, which includes understanding the appropriate application and management of direct restorative materials. The correct approach prioritizes patient education and realistic expectations regarding the longevity and maintenance of composite and amalgam restorations. It involves a thorough assessment of the patient's oral hygiene, dietary habits, and parafunctional activities, which are critical determinants of restoration success. By explaining the potential for wear, staining, or fracture, and outlining the necessary maintenance, the dentist upholds their ethical obligation to provide informed consent and to deliver care that is both clinically sound and sustainable. This aligns with the principles of responsible practice, emphasizing patient well-being and the judicious use of dental materials. An incorrect approach would involve overpromising the durability or aesthetic permanence of direct restorations, particularly composite, without adequately addressing the factors that influence their lifespan. This could lead to patient dissatisfaction and potential disputes. Failing to discuss the limitations of amalgam, such as its aesthetic properties or potential for corrosion, also represents a failure in informed consent. Furthermore, neglecting to assess and address the patient's oral hygiene, which is a primary factor in the success of any restoration, is a significant professional oversight. Ethically, this constitutes a breach of the duty of care and potentially misleads the patient about the expected outcomes and the necessary commitment to oral health. The professional decision-making process in such situations should involve a systematic evaluation of the clinical situation, the patient's needs and desires, and the capabilities of available restorative materials. This includes a comprehensive risk assessment, clear communication of treatment options with their respective pros and cons, and the establishment of realistic treatment goals. The dentist should always strive to provide evidence-based care that prioritizes the long-term oral health of the patient. Question 13. Operational review demonstrates a patient presenting with a crown on a posterior tooth that has been in place for 10 years. The patient reports intermittent sensitivity, and the crown appears to have a slight overhang at the mesial margin. Radiographs reveal a radiolucent area at the mesial root surface, extending slightly beneath the crown margin. What is the most appropriate course of action? Option A. Recommend extraction of the tooth and discuss options for replacement with a dental implant due to the suspected root surface decay. Option B. Perform a comprehensive diagnostic evaluation including clinical examination, radiographic assessment, and vitality testing to determine the cause of failure and formulate an appropriate treatment plan, which may include replacement of the restoration if indicated. Option C. Attempt to smooth and polish the mesial overhang and advise the patient to monitor symptoms, as the radiolucency may be a developmental anomaly. Option D. Immediately remove the existing crown and prepare the tooth for a new crown, assuming recurrent decay is the primary issue. The correct answer is B. Perform a comprehensive diagnostic evaluation including clinical examination, radiographic assessment, and vitality testing to determine the cause of failure and formulate an appropriate treatment plan, which may include replacement of the restoration if indicated. Explanation. Scenario analysis. This scenario presents a common challenge in restorative dentistry where a patient presents with a failing indirect restoration. The complexity arises from balancing the patient's immediate need for functional and aesthetic restoration with the long-term prognosis of the tooth and surrounding structures. Factors such as the extent of decay, the condition of the existing restoration, the health of the pulp, and the periodontal status all contribute to the decision-making process. A thorough diagnostic evaluation is paramount to avoid unnecessary or inappropriate treatment, which can lead to patient dissatisfaction, financial burden, and potential iatrogenic harm. Correct approach analysis. The correct approach involves a comprehensive diagnostic workup to determine the underlying cause of the failure and the most appropriate treatment plan. This includes a detailed clinical examination, radiographic assessment, including periapical and biodoing radiographs, and potentially CBCT if indicated, vitality testing, and periodontal probing. Based on these findings, dentists must then formulate a treatment plan that addresses the specific pathology. If the tooth is restorable and the prognosis is favorable, this might involve replacing the existing restoration with a new indirect restoration, crown or bridge, that is designed to meet current diagnostic standards and patient needs. This approach aligns with the ethical obligation to provide competent and evidence-based care, prioritizing the patient's oral health and well-being. It also adheres to the principles of informed consent, ensuring the patient understands the diagnosis, treatment options, risks, benefits, and alternatives. Incorrect approach is analysis. One incorrect approach would be to immediately proceed with replacing the restoration without a thorough diagnostic evaluation. This bypasses essential steps in identifying the root cause of the failure, which could be recurrent decay, fracture, poor marginal integrity, or even endodontic issues. Proceeding without this information risks repeating the same failure or undertaking a more invasive and costly procedure than necessary, potentially compromising the tooth's long-term viability. This constitutes a failure to adhere to professional standards of care and potentially violates the ethical duty to act in the patient's best interest. Another incorrect approach would be to recommend extraction and replacement with a removable prosthesis or implant, without first exploring the restorability of the natural tooth. Implants and removable prostheses are valid treatment options. They are typically considered when the natural tooth is deemed unrestorable or has a poor long-term prognosis. Prematurely recommending these definitive treatments without a comprehensive assessment of the tooth's condition can be considered overtreatment and may not align with the principle of preserving natural dentition whenever possible. This can also lead to unnecessary financial expenditure for the patient and may not be the most conservative or appropriate solution. A third incorrect approach would be to simply repair the existing restoration without addressing the underlying cause of its failure. Superficial repairs may offer temporary relief, but do not resolve the fundamental issue, leading to continued deterioration and potential for more significant problems in the future. This approach fails to provide definitive care and can be seen as a breach of professional responsibility to deliver durable and effective treatment. Professional reasoning. When faced with a failing indirect restoration, the professional decision-making process should begin with a commitment to thorough diagnosis. This involves gathering all necessary clinical and radiographic information to understand the extent and nature of the problem. Following diagnosis, treatment options should be evaluated based on their predictability, longevity, and impact on the patient's overall oral health. The patient's preferences, financial considerations, and medical history must also be integrated into the decision-making process. Open and honest communication with the patient, including a discussion of all viable treatment alternatives, their associated risks and benefits, and the expected outcomes, is crucial for obtaining informed consent and fostering a collaborative approach to care. The ultimate goal is to provide the most appropriate and conservative treatment that maximizes the long-term health and function of the patient's dentition. Question 14. Market research demonstrates a growing demand for advanced endodontic procedures among general dentists seeking to expand their practice offerings. A patient presents with a history of 2 prior root canal treatments on a maxillary molar, persistent periapical radiolucency, and intermittent, mild discomfort. The initial radiographs suggest potential missed canals or persistent infection. Considering the FAGD emphasis on evidence-based practice and patient-centered care, what is the most appropriate initial step in managing this complex case? Option A. Proceed with a 3rd root canal retreatment, assuming the previous treatments were incomplete, and manage any complications as they arise. Option B. Advise the patient that the tooth is likely non-restorable and recommend extraction and implant placement without further diagnostic investigation. Option C. Perform a cone beam computed tomography, CBCT, scan to obtain a detailed 3-dimensional view of the tooth and surrounding structures, followed by a thorough reevaluation of the diagnosis and prognosis, and consultation with an endodontic specialist if indicated. Option D. Initiate surgical endodontic intervention, such as an apicoctomy, based on the presence of symptoms and radiographic findings, without further diagnostic imaging or specialist consultation. Correct answer is C. Perform a cone beam computed tomography, CBCT, scan to obtain a detailed 3-dimensional view of the tooth and surrounding structures, followed by a thorough reevaluation of the diagnosis and prognosis, and consultation with an endodontic specialist if indicated. Explanation. This scenario is professionally challenging due to the inherent complexity and potential risks associated with retreatment and surgical endodontics, particularly when a patient presents with a history of prior unsuccessful treatment and persistent symptoms. The dentist must balance the patient's desire for definitive treatment with the objective assessment of prognosis and the ethical obligation to provide care within their scope of competence. The FAGD framework emphasizes continuous learning and the application of evidence-based practices, requiring a thorough risk assessment before undertaking advanced procedures. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic workup and a realistic prognosis assessment. This aligns with the FAGD commitment to patient welfare and ethical practice, which mandates that dentists only undertake procedures for which they are adequately trained and equipped. A detailed assessment, including advanced imaging and consultation, ensures that the patient is fully informed of the risks, benefits, and alternatives, and that the proposed treatment plan is the most appropriate given the clinical findings. This adheres to the principles of informed consent and prudent patient management. An incorrect approach that involves proceeding with retreatment without a thorough reevaluation of the diagnosis and prognosis would be professionally unacceptable. This could lead to further complications, patient dissatisfaction, and potential harm, violating the dentist's duty of care. Undertaking surgical endodontics without adequate training or consultation with a specialist would also be a significant ethical and professional failing, potentially resulting in suboptimal outcomes and exposing the patient to unnecessary risks. Similarly, dismissing the patient's symptoms without a comprehensive investigation would be a dereliction of professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's history and previous treatment records. 2. Conduct a comprehensive clinical examination, including vital signs and palpation. 3. Utilize advanced diagnostic imaging, e.g., CBCT, to gain a detailed understanding of the anatomy and pathology. 4. Formulate a differential diagnosis and assess the prognosis for both retreatment and surgical options. 5. Consult with endodontic specialists if the case falls outside the dentist's expertise or comfort level. 6. Engage in open and honest communication with the patient, discussing all findings, treatment options, risks, benefits, and expected outcomes to facilitate informed consent. Question 15. Compliance review shows a patient presenting with recurrent sensitivity and discomfort in a posterior quadrant previously treated with multiple restorations following significant trauma. The patient reports that the previous dentist just kept fixing it and expresses a desire for a long-term solution, but is also concerned about the cost of extensive treatment. The patient has a history of bruxism. What is the most appropriate diagnostic and treatment planning approach? Option A. Conduct a comprehensive reevaluation including detailed clinical examination, advanced radiographic imaging e.g., CBCT if indicated, pulp vitality testing and periodontal assessment. Develop multiple treatment options, clearly outlining the prognosis, risks, benefits, and estimated costs for each, including conservative management, retreatment of specific teeth, and potentially more extensive restorative or endodontic interventions to facilitate an informed patient decision. Option B. Proceed with replacing all existing restorations in the quadrant, assuming they are the source of the discomfort, and recommend a custom occlusal guard for bruxism. Option C. Recommend immediate root canal therapy on the most symptomatic tooth, followed by a full coverage crown, without further diagnostic investigation of other teeth in the quadrant. Option D. Focus on the patient's expressed desire for the least expensive option, which involves re-cementing existing restorations and providing a stock occlusal splint. The correct answer is A. Conduct a comprehensive reevaluation including detailed clinical examination, advanced radiographic imaging e.g., CBCT if indicated, pulp vitality testing and periodontal assessment. Develop multiple treatment options, clearly outlining the prognosis, risks, benefits, and estimated costs for each, including conservative management, retreatment of specific teeth, and potentially more extensive restorative or endodontic interventions to facilitate an informed patient decision. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and treatment planning for a patient with a history of significant dental trauma and subsequent restorative work. The dentist must navigate the patient's current symptoms, the limitations and potential failures of previous treatments, and the patient's expressed desires and financial considerations. Careful judgment is required to balance diagnostic accuracy with the development of a treatment plan that is both clinically sound and patient-centered, adhering to the highest standards of care expected of an FAGD candidate. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-based diagnostic process. This involves a thorough clinical examination, detailed radiographic assessment, and consideration of the patient's medical and dental history. The development of multiple, viable treatment options, each with a clear articulation of risks, benefits, and prognosis, empowers the patient to make an informed decision. This aligns with ethical principles of patient autonomy and beneficence, ensuring that the chosen treatment is the most appropriate for the patient's long-term oral health and overall well-being. As mandated by the Academy's commitment to advanced dental practice, an incorrect approach that focuses solely on replacing the existing restorations without a thorough reevaluation of the underlying issues fails to address the root cause of the patient's symptoms. This could lead to repeated failures and further complications, violating the principle of non-maleficence. Ethically, it bypasses the crucial step of differential diagnosis and informed consent regarding the full spectrum of potential issues. Another incorrect approach that proposes an overly aggressive or invasive treatment plan without exhausting less invasive options, especially when the patient expresses financial concerns, demonstrates a failure to consider the patient's individual circumstances and potentially violates the principle of proportionality in treatment. This could be seen as a failure to provide patient-centered care and could lead to unnecessary financial burden and patient dissatisfaction, contravening the spirit of responsible practice. A third incorrect approach that relies heavily on patient preference for a specific, potentially suboptimal, treatment without adequate discussion of its limitations or alternatives demonstrates a failure to uphold the dentist's professional responsibility to guide the patient towards the most beneficial course of action. While patient preference is important, it must be informed by professional expertise and a comprehensive understanding of all available options and their long-term implications. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information. History, symptoms, previous treatments. 2. Conduct a thorough clinical and radiographic examination. 3. Formulate a differential diagnosis. 4. Develop a range of treatment options, considering prognosis, risks, benefits, and patient factors, including financial. 5. Engage in detailed, transparent communication with the patient to ensure informed consent. 6. Select and implement the most appropriate treatment plan collaboratively with the patient. Question 16. Assessment of a patient's desire for a purely aesthetic, minimally invasive anterior restoration versus the clinical reality of significant occlusal wear and a history of recurrent caries. What is the most appropriate initial step in developing a treatment plan? Option A. Inform the patient that their aesthetic desires cannot be met due to the clinical findings and suggest they seek treatment elsewhere if they are unwilling to accept a more aggressive restorative approach. Option B. Recommend immediate full coverage crowns on all affected anterior teeth to ensure maximum protection and longevity, without extensively exploring less invasive alternatives. Option C. Conduct a comprehensive diagnostic evaluation, including occlusal analysis and caries risk assessment, and then discuss all viable restorative options with the patient, detailing their respective prognoses, risks, and benefits to collaboratively determine the most predictable and durable treatment. Option D. Proceed with the patient's preferred aesthetic, minimally invasive restoration, assuming that patient satisfaction is the primary objective, and address any subsequent issues as they arise. The correct answer is C. Conduct a comprehensive diagnostic evaluation, including occlusal analysis and caries risk assessment, and then discuss all viable restorative options with the patient, detailing their respective prognoses, risks, and benefits to collaboratively determine the most predictable and durable treatment. Explanation. This scenario presents a common challenge in restorative dentistry, balancing patient expectations, clinical realities, and the ethical imperative to provide appropriate care within the scope of practice. The dentist must assess the longevity and predictability of various restorative options, considering the patient's oral hygiene, occlusal forces, and the extent of existing damage. The FAGD designation signifies a commitment to advanced continuing education and a high standard of patient care, implying a responsibility to stay abreast of current evidence-based practices and materials. The correct approach prioritizes a comprehensive assessment of the patient's oral health status and a thorough discussion of all viable treatment options, including their respective prognoses, risks, and benefits. This aligns with the ethical principles of informed consent and patient autonomy, ensuring the patient can make a decision based on accurate information. It also reflects a commitment to evidence-based dentistry, selecting treatments that have demonstrated long-term success and are appropriate for the patient's specific condition. This approach upholds the professional responsibility to provide the highest quality of care, prioritizing the patient's long-term oral health over immediate aesthetic desires if those desires conflict with predictable and durable outcomes. An incorrect approach would involve proceeding with a treatment that is not clinically indicated or has a poor prognosis without fully informing the patient of these limitations. This could manifest as overtreating a condition or selecting a material or technique that is not supported by current scientific literature for the given situation. Such an approach risks patient dissatisfaction, potential treatment failure, and the need for further, more complex interventions, ultimately undermining the dentist's professional integrity and potentially violating ethical guidelines regarding competence and due care. Another incorrect approach might be to dismiss the patient's concerns entirely, failing to engage in a collaborative decision-making process. This disregards the patient's subjective experience and can lead to a breakdown in the patient-dentist relationship, failing to meet the standard of patient-centered care. Professionals should approach such situations by first conducting a thorough diagnostic workup, including clinical examination, radiographic assessment, and potentially diagnostic casts. Following this, a detailed discussion with the patient should occur, outlining all potential treatment pathways, their advantages, disadvantages, expected longevity, and costs. The dentist's role is to guide the patient toward the most appropriate and predictable treatment based on their clinical findings and the current body of scientific evidence, while respecting the patient's ultimate decision-making authority after being fully informed. Question 17. Comparative studies suggest that when a patient presents with moderate periodontal disease and a desire for significant aesthetic improvement in the anterior dentition, which of the following treatment planning principles best guides the dentist's approach? Option A. Prioritize a comprehensive periodontal treatment phase to stabilize the disease, followed by a discussion of all viable restorative and prosthetic options, considering their long-term prognosis and the patient's overall oral health. Option B. Immediately proceed with the most aesthetically pleasing restorative options requested by the patient, assuming that improved aesthetics will motivate better oral hygiene. Option C. Focus solely on the immediate aesthetic concerns, offering the quickest and most visually impactful cosmetic procedures available, deferring any discussion of periodontal health until after the aesthetic treatment is completed. Option D. Recommend a full mouth rehabilitation with extensive crowns and veneers, as this will address both the periodontal concerns and the aesthetic desires simultaneously. The correct answer is A. Prioritize a comprehensive periodontal treatment phase to stabilize the disease, followed by a discussion of all viable restorative and prosthetic options, considering their long-term prognosis and the patient's overall oral health. Explanation: this scenario is professionally challenging because it requires balancing the patient's immediate desires with the dentist's ethical and professional obligation to provide the most appropriate and sustainable treatment. The dentist must navigate potential patient pressure for less ideal, but perhaps more aesthetically pleasing or less invasive, options, while upholding the principles of evidence-based dentistry and long-term oral health. Careful judgment is required to ensure the treatment plan is not only acceptable to the patient, but also clinically sound and ethically defensible. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and a collaborative discussion of all viable treatment options, grounded in scientific evidence and the patient's overall health status. This aligns with the core tenets of patient-centered care, informed consent, and the dentist's duty to act in the patient's best interest. Specifically, it adheres to the Academy of General Dentistry's (AGD) emphasis on evidence-based decision-making and the ethical imperative to provide treatment that promotes long-term health and function, rather than solely addressing immediate cosmetic concerns if they compromise the underlying health of the dentition. This approach ensures the patient understands the risks, benefits, and long-term prognosis of each option, empowering them to make an informed decision. An incorrect approach that focuses solely on the patient's initial aesthetic preference without a thorough discussion of the underlying periodontal health and the long-term implications of restorative versus surgical intervention would be ethically flawed. This could lead to a treatment plan that is not sustainable, potentially requiring more complex and costly interventions in the future, and failing to address the root cause of the issue. Such an approach could be seen as a failure to uphold the dentist's duty of care and could violate principles of informed consent by not fully disclosing all relevant information necessary for a truly informed decision. Another incorrect approach might involve recommending a highly invasive or costly treatment without adequately exploring less aggressive, yet effective, alternatives that might be more suitable for the patient's current circumstances and long-term oral health goals. This could be perceived as overtreatment or a failure to consider the patient's overall well-being and financial considerations in a balanced manner, potentially leading to patient dissatisfaction and a breach of trust. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough diagnostic workup, including a detailed medical and dental history, clinical examination, and appropriate radiographic and periodontal assessments. Second, identify all potential treatment options, considering their efficacy, longevity, invasiveness, cost, and impact on the patient's overall oral health. Third, present these options to the patient in a clear, understandable manner, discussing the pros and cons of each, including potential risks and benefits, and the long-term prognosis. Fourth, engage in a collaborative discussion to understand the patient's values, priorities, and concerns, and to jointly arrive at a mutually agreed-upon treatment plan. Finally, document the entire process, including the diagnostic findings, treatment options discussed, patient's decision, and the rationale for the chosen plan. Question 18. Market research demonstrates that patients increasingly seek durable and aesthetic solutions for compromised teeth. Considering a vital maxillary premolar with extensive coronal destruction following root canal therapy, where the remaining coronal tooth structure is minimal, and the quality of the endodontic fill is adequate but not ideal, which of the following approaches best aligns with the principles of evidence-based restorative dentistry and the commitment to long-term tooth preservation? Option A. Perform a thorough assessment of remaining tooth structure, evaluate the ferrule effect, and select an appropriate post and core system, e.g., fiber post with composite core, based on the clinical findings, followed by a definitive restoration. Option B. Place a prefabricated metal post and core without further assessment, as this is a common and cost-effective solution for post-endodontic teeth. Option C. Fabricate and cement a custom cast post and core, followed by a full-coverage ceramic crown, prioritizing immediate structural integrity. Option D. Proceed with a direct composite resin restoration, assuming the endodontic treatment provides sufficient internal support. The correct answer is D. Proceed with a direct composite resin restoration, assuming the endodontic treatment provides sufficient internal support. Explanation. Scenario analysis. This scenario presents a common clinical challenge in general dentistry, determining the optimal post-endodontic restoration for a vital tooth with significant coronal destruction. The challenge lies in balancing the need for predictable long-term success, patient function, and aesthetics with the inherent variability in tooth structure, root canal treatment quality, and patient biomechanical forces. A critical judgment is required to select a restorative approach that minimizes the risk of fracture, leakage, and subsequent endodontic failure, while also considering the economic and time constraints of the patient. The FAGD designation signifies a commitment to advanced knowledge and clinical excellence, thus demanding a highly informed and evidence-based decision-making process. Correct approach analysis. The correct approach, which involves a thorough assessment of remaining tooth structure, ferrule, and the quality of the endodontic treatment, followed by the selection of an appropriate post and core system and a definitive restoration, represents best professional practice. This aligns with the Academy of General Dentistry's emphasis on comprehensive patient care and the application of advanced clinical techniques. Specifically, adhering to established guidelines for post-endodontic restorations, which prioritize the preservation of tooth structure and the creation of a stable foundation for the final restoration, is paramount. This approach minimizes the risk of catastrophic tooth fracture, which could lead to extraction, and ensures the longevity of the treatment. The decision-making process should be guided by evidence-based dentistry and a thorough understanding of biomechanics, material science, and restorative principles. Incorrect approaches analysis. Choosing to immediately place a direct restoration without considering the need for a post and core, despite significant coronal destruction, represents a significant regulatory and ethical failure. This approach neglects the fundamental principle of providing a restoration that can withstand occlusal forces and prevent microleakage, thereby increasing the risk of endodontic failure and potential reinfection. It fails to meet the standard of care expected of a dentist committed to advanced practice. Opting for a post and core without a detailed assessment of the ferrule effect and remaining tooth structure is also professionally unacceptable. Insufficient ferrule is a primary risk factor for post-fracture and tooth fracture. This approach demonstrates a lack of due diligence and a failure to apply critical diagnostic principles, potentially leading to a compromised restoration and adverse patient outcomes. Selecting a post and core system based solely on cost or ease of placement, without considering the specific clinical situation, biomechanical requirements, and the quality of the endodontic treatment, is another ethical lapse. This prioritizes convenience over patient well-being and the long-term success of the treatment, which is contrary to the FAGD commitment to excellence. Professional reasoning. Professionals should employ a systematic decision-making framework when faced with post-endodontic restoration challenges. This framework should include 1. Comprehensive clinical assessment. Evaluate remaining tooth structure, periodontal health, occlusion, and the quality of the endodontic treatment. 2. Ferrule assessment. Determine if adequate ferrule at least 1.5-2 mm of sound tooth structure coronal to the preparation margin is present. 3. Material selection. Based on the assessment, choose appropriate post material, e.g., fiber post, cast post, and core material. 4. Restoration design. Plan the definitive restoration, e.g., crown onlay, to provide adequate support and protection. 5. Patient communication. Discuss treatment options, risks, benefits, and prognosis with the patient. 6. Evidence-based practice. Continuously update knowledge and apply current research findings to clinical decisions. Question 19. To address the challenge of ensuring comprehensive patient safety and optimizing treatment outcomes, what is the most appropriate approach for a general dentist to take when reviewing a patient's medical history prior to initiating dental treatment? Option A. Conduct a detailed verbal interview with the patient, asking specific questions about their medical conditions, medications, allergies, and past surgeries, and cross-reference this information with their current oral health status and proposed treatment plan. Option B. Delegate the entire medical history review process to a dental assistant, trusting their judgment to identify any significant issues without direct dentist oversight. Option C. Briefly scan the completed medical history form and proceed with treatment if no immediately obvious serious conditions are noted, deferring further inquiry to a later appointment. Option D. Rely solely on the patient's completed medical history form, assuming all information provided is accurate and complete without further verbal clarification. The correct answer is A. Conduct a detailed verbal interview with the patient, asking specific questions about their medical conditions, medications, allergies, and past surgeries, and cross-reference this information with their current oral health status and proposed treatment plan. Explanation. The scenario presents a common yet critical challenge in general dentistry, effectively reviewing a patient's medical history to ensure safe and appropriate treatment. The challenge lies in the potential for overlooked or misunderstood information to lead to adverse patient outcomes, contraindications, or ineffective treatment. A thorough medical history review is not merely a procedural step, but a cornerstone of patient safety and ethical practice, directly impacting the dentist's ability to provide care within their scope and to manage potential risks. The correct approach emphasizes a comprehensive and proactive review, involving direct patient engagement and a systematic assessment of all provided information. This aligns with the fundamental ethical obligation to act in the patient's best interest and to practice competently. Specifically, it reflects the Academy of General Dentistry's commitment to lifelong learning and the application of current scientific knowledge, which includes understanding how systemic health impacts oral health and treatment planning. This approach ensures that potential drug interactions, allergies, systemic conditions affecting oral tissues, or factors influencing healing are identified and managed before treatment commences, thereby minimizing risk and optimizing patient care. An incorrect approach that relies solely on a pre-filled form without further inquiry fails to acknowledge the nuances and potential for misinterpretation inherent in patient-provided information. This can lead to regulatory or ethical breaches by neglecting the dentist's duty to obtain informed consent based on a complete understanding of the patient's health status. Another incorrect approach, which dismisses seemingly minor historical details as irrelevant, risks overlooking critical information that could have significant implications for treatment. This demonstrates a failure to exercise due diligence and professional judgment, potentially violating the standard of care and the ethical principle of non-maleficence. Finally, an approach that delegates the entire medical history review to auxiliary staff without adequate oversight or verification by the dentist represents a failure of professional responsibility and supervision, potentially leading to errors that the dentist remains accountable for. Professionals should employ a decision-making framework that prioritizes patient safety and comprehensive assessment. This involves actively listening to the patient, asking clarifying questions, cross-referencing information with the patient's current presentation, and consulting with medical professionals when necessary. The process should be iterative, allowing for adjustments to the treatment plan based on the evolving understanding of the patient's medical profile. Question 20. Governance review demonstrates a consistent pattern of patients requesting less frequent periodontal maintenance appointments than initially recommended by the practice. In one specific case, a patient with a history of moderate periodontitis, who has been stable on a 3-month recall schedule for the past 2 years, now requests to move to a 6-month recall, citing financial concerns and a perceived lack of active disease. As a fellow of the Academy of General Dentistry, FAGD, how should you ethically and professionally address this request to ensure optimal patient care and adherence to best practices in supportive periodontal therapy? Option A. Immediately agree to the patient's request for a 6-month recall to maintain patient satisfaction and avoid potential conflict, assuming their financial concerns are paramount. Option B. Offer a compromise of a 4-month recall, acknowledging the patient's request but without a detailed reevaluation or explicit discussion of the underlying periodontal risks. Option C. Conduct a thorough periodontal reevaluation, discuss the patient's specific risk factors and the evidence supporting 3-month recalls for their condition, and collaboratively develop a revised treatment plan if appropriate, clearly documenting the rationale. Option D. Insist on maintaining the 3-month recall schedule without further discussion, explaining that it is the standard of care and the patient must comply. The correct answer is C. Conduct a thorough periodontal reevaluation, discuss the patient's specific risk factors and the evidence supporting 3-month recalls for their condition, and collaboratively develop a revised treatment plan if appropriate, clearly documenting the rationale. Explanation. This scenario presents a professional challenge because it requires balancing a patient's expressed desire for less frequent periodontal maintenance with the dentist's professional judgment regarding the optimal frequency for disease control and prevention. The dentist must navigate the patient's autonomy and preferences while upholding their ethical and professional responsibility to provide evidence-based care that promotes the patient's oral health. The Academy of General Dentistry, AGD, emphasizes continuing education and the application of current scientific knowledge in practice, which includes understanding the risk factors and progression of periodontal disease. The correct approach represents best professional practice because it prioritizes a thorough risk assessment and shared decision-making. By explaining the rationale behind the recommended maintenance schedule, including the patient's specific risk factors, e.g., history of periodontitis, smoking, diabetes, genetic predisposition, and presenting evidence-based guidelines, the dentist empowers the patient to make an informed decision. This aligns with ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to self-determination. The AGD's commitment to lifelong learning and evidence-based dentistry supports this approach, as it ensures that treatment decisions are grounded in the latest scientific understanding of periodontal disease management. An incorrect approach would be to unilaterally dismiss the patient's request and insist on the original schedule without further discussion or assessment. This fails to respect patient autonomy and can lead to non-compliance, ultimately undermining treatment success. Another incorrect approach would be to immediately agree to the patient's request for less frequent visits without a comprehensive reevaluation of their periodontal status and risk factors. This could be seen as a failure of professional diligence and potentially violate the dentist's duty of care, as it might lead to disease progression and adverse outcomes. A third incorrect approach would be to offer a compromise that significantly deviates from evidence-based recommendations without a clear, documented justification tied to the patient's specific circumstances, potentially exposing the patient to unnecessary risk. Professionals should approach such situations by first actively listening to the patient's concerns and understanding their motivations for requesting a change. This should be followed by a comprehensive periodontal assessment to reevaluate the patient's current disease status and risk factors. Based on this assessment and current evidence-based guidelines, the dentist should then engage in a transparent discussion with the patient, explaining the risks and benefits of different maintenance frequencies. The goal is to reach a mutually agreed-upon treatment plan that respects the patient's autonomy while ensuring optimal periodontal health outcomes, consistent with the FAGD's commitment to excellence in general dentistry.